to describe the way that stigma works. I think that word would be crushing.
You find that everything is covered up in cling film and all that, and you're like, why are they covering up all these things? And then you think, is it because I'm HIV?
Stigma is the killer in this disease. You can almost live with the disease, but you can't live with the stigma.
We have a right as any other person to be treated fairly.
Stigma.
I'm giving Stigma the Index Finger.
Stigma the Index Finger.
We've been involved in this amazing project over the last 8 months called the People Living with HIV Stigma Index rollout in the UK. It's taken me 6 months to be able to say that. It's been an incredible experience, and we're here really just to kind of share some of the findings with you.
Essentially, the UK part of the project is the UK is the first country in Europe to work with the index, and this project this year has been funded by the MAC AIDS Foundation and also by the Scottish Government. And at the international level, that's the same thing. It's been part of a partnership between two international networks, People Living with HIV, that's GMP Plus and ICW, between IPPF and also between UNAIDS.
The reason why we have a project specifically relating to stigma is that it's been increasingly recognised universally that stigma is one of the biggest barriers for people in accessing treatments, services, testing, supports, all sorts of other quality of life type things.
The process for developing this index began, if you all can picture this image, I said it was audience participation. I was in the shower and I thought about the fact that so much we speak about, even 5 years ago, about stigma. But it wasn't, we always know about healthcare provider attitudes and household surveys that measure stigma. Nobody ever asked people living with HIV, tell me your experience in the past 12 months. And I think that's what's important about this. This wasn't stigma that I may have experienced 20 years ago. This is in the last 12 months.
How did we do it? We interviewed 867 people from Aberdeen to Portsmouth, South, Mid, North Wales to East London. 35 community researchers were trained in London and Glasgow.
The questionnaire that's the central tool for the People Living with HIV Stigma Index brought together a whole group of experts, and those experts were people living with HIV, were researchers, statisticians, human rights experts, healthcare providers, a whole group of people to look at the kinds of questions that should be included in this questionnaire.
A lot of people with HIV in the UK are researched out when they realised that it had the full backing of the UN and it was part of a global initiative. It had a different kind of buy-in, but I think the thing that really made it interesting for people was the fact that everybody that is on the project was living with direct experience of that moment when somebody had said to them, I'm afraid your test result's positive.
I'm making my feelings on the paper and how I came to be involved in this project. It was because I felt my heart was broken, so I've put a broken heart. And the next stage, I'm going to put the heart together, picking up the pieces, and then the final stage, I'm going to put the heart embraced. It's all about love.
I got involved because I was very impressed that they really were
throughout the whole of the project, involving positive women, positive people in a meaningful way.
There are a lot of people out there who gets pushed around, and they are silent voices, and they need somebody to speak up for them and make the world aware that there are these things going on, and people really should learn more about HIV. It is only a virus that lives in a person, but it doesn't change the human being.
It's so cruel, and leaves me lost for words, really. And anything I can do to dispel stigma and discrimination, I'll do it.
One of the great opportunities, but also big challenges we've had with the rollout of the People Living with HIV Stigma Index in the UK is that it is one of the first countries around the world to complete or to undertake a full implementation. So in some ways we had to be very innovative and pioneer and pave new ways for doing things, whether that was the protocol for data entry or how we structure the recruitment process to reach out across the different organisations throughout the UK, to how we run the training with the interviewers and the researchers. In every country that works with the Stigma Index, we'll have amazing community advocates standing up saying these are the key issues in our country that have come from the research, this is the change we want to see, and this is how we're going to do it. And we're starting to already have a collection of great community advocates from around the world who sort of forming this anti-stigma movement, if you like.
This work's essential. There's all sorts of important aspects of it. It's really important for people who are living with HIV. Some of them don't use services the way they should do because HIV is a very treatable condition, but you've got to come to clinic, you've got to feel comfortable to walk through that door. Obviously there's a risk that you might be recognised. If you're worried that being recognised is going to count against you, that somebody might hold that against you, you might be put off coming to clinic. That's not good for your health.
There's a lot of work can be done, and I think it's now about each person that's involved in the project running with the bit that they're most passionate about and really trying to ensure that the data is put out to the right people.
This is the outcome. This will be something that we can all work with, we can all look to. We need to get together, we need to have more coalition, more thinking out of the box, ways that we can break down stigma.